So welcome to our listeners to the Strongest Steel Podcast. This is episode 30 of the United Steelworkers District 3 Strongest Steel Podcast. I'm Scott Lunny. I use pronouns he and him, and I am the director for Western and Northern Canada for the United Steelworkers, what we call District 3. And I am recording this, or we are recording this with my trusty team here on the traditional unceded territory of Coast Salish people, the Squamish, Musqueam, and Tsleil-Waututh Nations, and glad to be able to live and work on the territory of those First Nations. And we have an interesting episode today, or I think is interesting, with our guest, Chris Gallaway, who I first met when he was working for the Alberta Federation of Labour, but now has a really even more important job, I think, as the defender of our public Medicare system at the front lines of where it's being attacked in Alberta. And so we were just doing some work with a couple other unions in Alberta, and Chris was speaking to the group about the challenges to our public healthcare system coming from the Alberta government, from the Alberta UCP government, and Danielle Smith. And I thought, wow, we should really get Chris on the podcast to talk more about that and make sure more folks understand what is really critically happening and could happen in Alberta. So with that, I'll introduce Chris, and maybe you can do a bit of a better introduction of yourself and tell us what you do for all of us in Alberta.
Yeah, thanks, Scott, and thanks for having me. Good to see you again. So I'm Chris Gallaway. I'm the Executive Director of Friends of Medicare. I'm happy to be joining you from Treaty 6 here in Edmonton. And for those who don't know, Friends of Medicare, we're kind of like those health coalitions you have in other provinces, but we exist to protect and strengthen public health care for all. We really believe in that idea that no matter who you are or where you live or how much money you have, you deserve access to the healthcare you need when you need it. And so that's the work we've been doing for 47 years here in Alberta, is fighting to ensure everyone has the public healthcare they need when they need it. But obviously right now in Alberta, we have a lot of challenges on that front.
Yeah. So, again, thanks for doing that, because, I think it's something that's deeply important to, I think, most Canadians, if not all Canadians, is our public healthcare system. But it's not something we run around and defend, take efforts to defend every day. So, but there are people who want to tear it down, and so there is a need to defend it. So thank you for doing that. For our folks that are listening that maybe aren't following closely, or maybe folks who are following closely and can't keep up, what are the things that are, being changed and proposed in Alberta that really present a threat to the public healthcare system? I think nationally, but first of all, primarily in Alberta.
Yeah, and absolutely. It's not just Alberta. The whole country will be impacted by what we're doing here. And you're right that people often take it for granted. This idea of public health care is so baked into Canadian identity that we don't often stand up and fight for it. We just assume it'll be there. And now we're seeing the impacts of that in Alberta as we have a government full steam ahead on destroying our public healthcare system. So there's been a couple things happening over the last 2.5 years. There's this massive restructuring of healthcare where they've blown up Alberta Health Services and our whole system into pillars. So there's these 4 pillars and a dozen agencies, and really just fragmented the whole system of care, created chaos on the front lines for anyone who works in healthcare. And it's really a strategy to break the system in order to privatize it, which also includes deregulating and busting the unions and the classic privatization agenda we see. But the other piece they've been doing is massive legislative overhaul. They've just pushed through the 3rd Health Statutes Amendment Act in less than a year, going after diagnostic testing in this case. But we've previously seen attacks on our public hospitals and Bill 11 that passed in December. And basically all of these bills are legislating into place full-on 2-tier American-style healthcare, where those with money will be able to pay to access care, and everyone else will be left waiting longer. It prioritizes for-profit healthcare providers. And really, all of it is about the insurance industry, which I know we're going to talk about today.
For sure. So that Bill 11, like if you listen to them supporters of Bill 11, they would say, well, this is just about reducing wait times, which everybody wants, right? Like nobody really, we like our public health care. We'd like it quicker, right? And so it's kind of, built, no pun intended, but it's kind of Bill 11's kind of billed as, well, we're just reducing wait times. Like but there's more to it than that. Yeah,
and of course, we all want to bring down wait times, and there's proven ways to do that has been done in other jurisdictions in the public system, if that was the real goal. To us, the goal of this government is to dismantle universal public health care. But when they do these things, whether it's labs, whether it's surgeries, whether it's diagnostics testing, they propose privatization as a solution to access. So they always say it's going to shorten wait times, it's going to increase capacity, and we're going to save money by doing it. And then once they do those things, they never come true. And we saw that with the huge disaster with our labs in Dynalife that cost us over $125 million to bring the system back in-house after it totally fell apart. We've seen that with our surgical initiative where wait times are going up and up. Our public hospitals and operating rooms are struggling to be staffed. Our wait times are going up for surgeries. So the actual impact of these decisions isn't what they claim it's going to be. So they're trying to sell it to Albertans as you'll get your surgeries faster, you'll get your diagnostics faster, it'll be better for you. But that isn't what's happened as they've started rolling these things out. So, the data of the government's own data shows their claims aren't true. So it's a false bill of goods they're trying to sell to people as they ram this through.
Mm-hmm. And you mentioned this, Chris, already, but the beneficiary of privatized healthcare is insurance companies, right? And you need only look to the south. I get to go get to see the U.S. a little more firsthand, as part of our international executive board, and talk to our other directors and folks in the States about how the healthcare system works there, but. Lots of money flows to, they actually spend more money in the U.S. On healthcare than we do. They got massive amounts of people that aren't even covered, and who makes out like bandits is insurance companies.
Absolutely, yeah, they're not struggling. The insurance companies for sure, and the steelworkers know this well, having relations across the border. But when we talk about Bill 11 at Friends of Medicare, we often try to hammer home. It's talked about as a healthcare bill. But what it actually is an insurance bill. And it's getting rid of that idea of single payer public Medicare as your insurance that covers care, and opening the floodgates to insurance companies to sell products for medically covered services that are already covered under public health care. So testing, surgeries, doctors, and so on. And the way they're doing it, and we're waiting for the implementation plan, but what they've stated their goal is to start with workplace benefit plans as how to start insuring those services. So they present it as a benefit that you could bargain and get MRI coverage or surgery coverage added to your health plan at work, or your employer could offer that as an incentive. And very well with your relations with the U.S. what that actually looks like, the cost of that, what it means for bargaining power, what it means for wages. If suddenly you're having to push for all of your healthcare coverage to be part of your work and employment and your benefit plan, it's a horrible road to go down. But the insurance companies in Alberta are very excited about it, and they're saying that publicly. Their association that lobbies is saying this is amazing news for insurance companies. So we can't imagine how that's amazing news for workers and patients if the insurance companies are this happy.
Yeah, for sure. Like the most recent one, one of the most recent bills, if I got it right, I think it's for some lab services or something like that, and it puts the public system or the government as the last payer. So if you've got any kind of other coverage or whatever, it's got to be the first payer for those services, right? Which really just you just means it's coming out of you're paying twice as a like if you're as a worker you're paying twice because you're paying taxes, but you're also for healthcare coverage that you're now having to pay
out of pocket or
an insurance company to cover. Yeah, if you don't have benefits bargained or from your employer, you're paying out of pocket. But if for insurance, but if you do have it, you're you're paying higher premiums, and our folks will say, well, you're not paying the premiums. Well, you are, because you're bargaining, instead of wage increases, you're bargaining increases in insurance cost. And so it's just coming out of your pocket. You're paying, even if you don't think you're paying. And that's what happens in the States. The first thing we got to bargain is healthcare coverage. And then we can talk about wages and pensions and things like that. But first we got to make sure that there's healthcare coverage. And that's, the employers are not, as you know, and I think we all know, they're not benevolent. They're not giving you that extra healthcare coverage or paying those extra premiums on your behalf, and still giving you the same kind of wage increases that you want to bargain. They're taking it out of the overall monetary package, or they're demanding, which we have a lot of pressure, is co-paying, where the members are paying a huge part of their insurance premiums for healthcare.
It's co-pays, or it's caps, or it's things to bring down the cost of those benefit plans. We already see that in Canada with drug plans and dental and other things. So it will be the same road for all of our healthcare if we move forward the way Alberta's going. And they've been doing that, the first payment thing, on different issues. So now government drug plans, if you have private insurance, it's the first payer. They tried to do it with insulin pumps and back down. And now we're seeing it with diagnostic testing in this legislation. And we fully expect to see it with all these other pieces in terms of surgeries and other things that they're going to start allowing insurance companies to sell products for, that they'll say, well, if you have private insurance, that'll pay first and the public system's only thereafter. So you know what that means for employer costs, for patient costs and so on. We're going to be paying that multiple times to get the same care or worse care.
And it seems the opposite direction from, I think we're seeing in like Manitoba and BC, and even federally in the last parliament, there was like moves to expand public health care to more things, to cover more things for folks. And what sort of shocked me is Alberta's going in the exact opposite direction of, I think, probably what folks want. I think certainly what folks want, but also what other governments are able to do. And it's not like they're saving any money by doing it, because they have as big a deficit as BC, I think.
It's costing us more. And BC and Manitoba are good examples. They signed onto the pharmacare plan. We haven't in Alberta, the national plan. And Alberta's trying this year to pull us out of the national dental care plan, which they have nothing to do with. It's a fully federally provided plan. And Alberta's saying, no, we shouldn't have Albertans covered by that, because at every turn, their priority is the insurance industry. And I know for steelworkers, you're very aware, we're in trade negotiations right now with the U.S., and we're very worried that Bill 11 and allowing insurance companies in to sell these products could undermine our trade protections for public health care for the whole country. If we allow American health insurance companies into Alberta to sell products, they'll then have standing in Canada. And what does that mean for the rest of the country under our current trade agreements, or under, if there's a new CUSMA negotiated, however that goes? What does this look like for our protections to public health care? Because right now, single payer public health care is protected in our trade agreements, but Alberta may be undermining that for the whole country.
Yeah, so we should be concerned all across Canada, all across Western Canada for sure, for our District 3 listeners, but all across Canada about what's going on in BC. Is there a role for like our national government here to step up? Like we have a country, right? We have a constitution. We have all that stuff. Like, provinces, I know they like to run a little amok, but they shouldn't be able to tear down something as sacred as our public healthcare system just because one province is, got some different ideas. Like, Absolutely. What can Ottawa do about this?
Absolutely. Yeah. We have a Canada Health Act, something we just celebrated the anniversary of recently. But, it's a piece of legislation that reminds us that healthcare has always been a federal and provincial partnership in Canada. The reason we have national public healthcare is because it's a deal between the federal government and provinces cemented through the Canada Health Act. And the federal government should be enforcing that act, because what's happening in Alberta is a blatant violation of the Canada Health Act. If it's allowed to proceed, we have legal opinions that state that very clearly, that there is no way Alberta can proceed with Bill 11 and some of their other changes and be in compliance with the Canada Health Act that is supposed to ensure universal access and so on. And so we need our federal government to speak up and stand up. Unfortunately, our health minister federally has not said anything about this legislation. All they'll say is they're in conversations with Alberta. They won't even say that the act is very clearly a violation of the Canada Health Act, let alone move forward on enforcement. Alberta gets over $7 billion in federal health transfer to pay for healthcare. The federal government has a role and leverage to say, no, you can't undermine healthcare for the whole country in Alberta with under current legislation. So we're really pushing hard to see that action. We lobbied on the Hill in Ottawa. We've had thousands and thousands of Albertans write into the minister saying, Albertans want you to do your job and enforce the Canada Health Act.
For sure. That's great. And yeah, that's something that I'm sure, I do know that we support. I mean, we add our voices as the steelworkers to all that stuff in terms of lobbying. I'm told that you went all across Alberta and had conversations with folks. Yeah. I think it says 19 places you went and talked about this. Can you let us know what you hear? Yeah. What do people say? Are people aware of this in Alberta and fighting back, or is it something we need to do more work to spread the word?
Absolutely. We're running the largest campaign we've probably ever run since Ralph Klein tried to bring in his third way and push that through and eventually back down. So we've been, spending money on advertising and reaching people all over the province, but we've also been on the road going to communities. So you're right. I've been to 19 different communities for town halls, and we actually have a few more coming up. So people keep inviting us to come when they hear about it. So if they want us to come to their community, we will do that and hear from people directly. And so we've spoken to thousands of people across the province about this, and they're showing up in big numbers. They're filling rooms in communities we've never been to because people are very worried about accessing healthcare right now and these massive changes. They're very worried in rural communities that if we go down the road of two-tier private healthcare, that they won't have any services because it's not profitable to provide services in High Level or Stettler or wherever they might live.
Right.
But also it's a stark reminder that nobody in Alberta voted for this, no matter how they voted. The premier didn't run on it. She ran on a public health guarantee. She ran on fixing wait times on certain things in the system. She ran on protecting public health care in their platform. And then once got elected, announced the destruction of Alberta Health Services and has rammed through these multiple bills to tear the whole thing down. So regardless, it's not a partisan thing. No matter how they voted in the last election, no one voted for this agenda. And in the polling we've seen recently and being on the road, it's very clear that no matter how people voted, the vast majority don't support a two-tier American-style healthcare system. The vast majority say they don't support what the government's doing. And so we're out there trying to mobilize people to show that dissatisfaction to the government, especially in those constituencies that are represented by government MLAs, to say, this is up to you. You have to tell them you don't want this if you want to stop it. And, we've had thousands and thousands of people sign our petitions and so on, but we're really trying to organize on the ground through our local chapters and volunteers in those communities to say, it's not about how you voted last time. It's about what you want now, and you need to tell the government that now, and then think about that in the next election.
For sure. Yeah, no, I think actually the point that you made about rural healthcare, which is a challenge at the best of times, but being really absent if we move to a for-profit system, and everybody knows that it's there's going to be centers where it will be profitable, where there's lots of people, right? Which will be, in Alberta's case, the two big cities probably, and everyone else will get left behind. And that's another the point for our members, I really think, is ultimately private healthcare costs and moving things out of the public system is going to cost you. It's going to come right off of your paycheck, whether it's in copay or whether it's in trade-offs that we have to make in negotiations. Yeah. And the other thing I think for our members is that most of our folks are not right downtown in Calgary or Edmonton, and if you think it's tough to access healthcare now, just wait, right? If it's a private system. So, yeah, I think that's great information to have. Yeah,
and it's such
about all this.
I'm sorry. It's such a
go ahead. Yeah,
like it's an economic issue too, and we've seen Jim Stanford did a good report recently. But if you're in Hinton or Grand Prairie or a forestry town or a manufacturing town, you're not going to have those industries anymore if you lose your healthcare and your schools, which is also under attack in Alberta. Employers aren't going to set up there because they need to know they'll have a healthy workforce and so on. And it's very clear economic impacts if we go down this road for communities, especially the more rural and remote you get. We were recently in Grand Prairie for our town hall, and they're kind of the center of the middle of nowhere. And they're struggling to keep their emergency room open, to have doctors and diagnostics and so on. If they lose all of that to a two-tier system and everyone has to go to Edmonton for everything, there's not going to be private employers and economic development in those regions anymore. So it very much is tied to our economy here in Alberta, which is very rural in terms of where the resources and wealth are happening.
Yeah, for sure. Yeah, you mentioned, Chris, about petitions and volunteers that you have for Friends of Medicare. Like, what you must have a website, ways that people can chip in and help out. So how about telling us those things?
So if you go to friendsofmedicare.org, there's an actions tab, so you can send a message to the federal government. You can sign on to tell the provincial government you don't support what's happening. But there's also, you can join as a member. Any Albertan can be a member of Friends of Medicare. We're made up of individuals and groups that care about public health care as a nonprofit. So we've had hundreds of new members joining as we've been on tour because people are very worried. So people can do that, but they can also sign up to volunteer. So there's lots we're doing to gather signatures, table, be out in public. And part of our volunteer model has chapters. So they're local chapters in, Lethbridge or Fort McMurray or Red Deer or Drayton Valley and so on, where groups of people in their community are taking action to protect and fight for public health care. So they're often tabling at markets or having events or leafleting or meeting with their local MLAs and so on, those kind of activities. So people can get involved that way too, with a group of people in their community who care about public health care and want to organize a pushback on the ground. So there's lots of ways people can get involved. And of course, yes, there's those online actions people can take on the website as well.
Cool. And so our local unions could join Friends of Medicare.
Absolutely.
Too, if they haven't already.
Yes, they could. And I know some of your members in Alberta.
I feel a letter coming from my from my office coming in the near future. So if you're a local union in Alberta, get ready.
Yeah. Well, and some of them work in healthcare, right? There's a lot of private long-term care and seniors care here, and some of them are steelworkers. I've met with them before.
That's for sure. Yeah. Okay, well, I don't know if there's anything else, Chris. I don't want to keep you too long because it sounds like you're really busy and you've got some more places to visit and a public healthcare system to defend. But if there's anything else you want to leave with our listeners about what's going on around healthcare and in Alberta or across the country?
Yeah, it's, I don't often bring good news to these things right now. It's often a bit of a downer what I have to share, but we're in an existential moment when it comes to public health care. And so anyone listening, if you care about having access to public health care and free universal Medicare, this is the moment to do something about it, because in the coming months, we're about to decide in Alberta whether we're going to get rid of that system altogether or not. So this is the moment to take action, speak up, and get organized.
Thanks. I don't think I could say that any better. So that was great, Chris. I really appreciate you taking the time, and I really appreciate the work that you put in. I mean, I do see you get on the news every now and sometimes they spell your name wrong on the news, I noticed, but hopefully we did it right. I'm looking over, make sure they spell your name right on the stuff when we push this podcast out. But I know you do a ton of work on behalf of all of us, like I said at the start, on the front line of the attacks on our public healthcare system. And I just urge anyone who's listening to do just what Chris said is, join up, sign up, do something to stand up for our public healthcare system. It's important that we not just keep it intact, but we work to grow it and expand it. And it is truly a Canadian thing that we need to embrace and make better, not tear down. So I really appreciate you taking the time, and I appreciate people listening to episode 30 of the Strong as Steel podcast. If you want more information about District 3 of the Steelworkers, you can find it at usw.ca/District3. If you have any questions or comments about the podcast, you can email d3comms@usw.ca. Please share around the podcast and subscribe on the various streaming things, and follow us on social media at at District 3? What? USW District 3. I should know that. And again, thanks for listening. This has been the Strongest Steel Podcast, and we'll see you next time.